Okay, for those of you who don't know me, my name is Deborah Axelrod, and I'm the medical director of the Community Outreach and Education Programs at NYU Cancer Institute. We do these programs 1 or 2 times a month. They're free of charge, and they range anywhere from new medications, new research, new risk reduction methods for different cancers, some of the treatment complications that you may encounter, and lifestyle modifications that you can make. So this is one of those, kind of like a survivorship talks and demonstration, and we titled this, "Can Foods That Taste So Good Be Good for You Too?" And we have a wonderful program. We have Marcy Brownstein, who has been in the catering business for 12 years before she had her other life. And we have 3 other wonderful chefs. I'm going to introduce them. Evelyn, I'm just giving you a shout out. So Evelyn and Tess and Aliyah. Aliyah. And they come from the Natural Gourmet Institute for Health and Culinary Arts on West 21st Street, and they may want to mention something about their program and their certification. Okay, so I just thought I would introduce the topic because I'm not a cook. I like to eat, but I can't give you advice about cooking, nor do I think you'd want my advice. So I thought I would talk a little bit about some of the conflicting information that's out there, some of the good stuff, some of the bad stuff, a little bit of overview about cancer survivorship in general. There are 11 million cancer survivors in the United States. About 2.5 billion of them are breast cancer survivors. This is not a talk for just people who have had breast cancer, and it's really for people who just want to learn how to eat healthy. If you're cooking for 1, if you're cooking for 10, we're going to get some really good pointers. But I wanted to talk to you about what some of the guidelines are for what we consider to be healthy eating, some of the things that we should try to abstain from or reduce in our diet. Okay, well, this really just hit the press today and yesterday, and I'm sure that you all heard about it if you turn on the news. So tonight, what you're missing, and you can just Google this, the Talk of the Nation, they're going to be updating you on the new consensus and the new guidelines for calcium and vitamin D. It seems that we may be overdosing ourselves with vitamin D and calcium, more so maybe with calcium. I know that it's very, very frequent that we get vitamin D levels drawn on patients, and now the Institute of Medicine has come out with maybe the reference levels should be a little lower than they are, and so that probably would put a lot of people in the exact range they need to for calcium. And I must say that I have women on calcium glucarate, mega doses, because they get it from their complementary and alternative providers. I'd watch out for that. Too much calcium is not a good thing. And also vitamin D. A lot of vitamin D can also increase fracture and stones and vomiting, and it can kind of mimic high calcium levels. And so in your packet, you'll have, these are the new guidelines that came out today on calcium and vitamin D. And you have that. So I won't go over that with you. So studies are conflicting about what to eat, but I always think that common sense should prevail. And that makes sense to you, doesn't it? Mm-hmm. If it's not healthy for your kids, it's not healthy for you. If you think that it's sprayed with pesticides, don't eat it. So this was a study. Now there are 2 studies I'm going to show you for breast cancer and vegetables and fats. This is a study that unfortunately I'm going to have to walk around here just to kind of look at it. This is the Women's Interventional Nutrition Study. This is a study that I actually participated in several years ago. Women who had breast cancer were enrolled, and the enrollment consisted of limiting the amounts of fats in your diet to about 20%. And it didn't really specify the kind of fat, which was a problem with the study, and we see that with other studies as well. But what it concluded was that that it was really in postmenopausal women that a low-fat diet did, that some women did experience significant weight loss, which may have contributed to why it was of benefit in reducing the risk of recurrence. And what they found also was that in one particular subgroup, these are triple-negative breast cancer survivors, they actually benefited the most. So if you look at the control group, which is the dotted line on top, and the diet, these are the women who were put on these specific diet, there is a difference, and there were less events, less recurrences in the women who had this particular special low-fat diet.
Meaning 20%?
It was 20%, but it didn't. It wasn't very specific about what kind of fats that you should limit. But you need to have a very good chef to make you a good edible diet that's 20% of your fats as calories. Okay, so this was another study that is the Women's Healthy Eating and Living, the WELL study. This is a randomized trial, and what they looked at is they also looked at diet in women who were survivors of early stage breast cancer. You can see here that these were women who, in the intervention group, these were women who had 5 vegetable servings, including juice, 3 fruit servings, 30 grams of fiber, which is really hard to get unless you start your day with a big bowl of cereal. I mean, unless you guys unless you can tell us otherwise. And 15 to 20% of the caloric intake was from fat. And what they concluded, and this is why things are conflicting, is that adoption of that particular diet, very high in veggies and fruit and fiber, and low in fat, did not reduce other breast cancer events. So, there are a lot of studies like this. For every study that I show you that's a positive study, I can show you a negative study about that. Right. But again, these studies were not initially designed to look at the good fats and the bad fats and the weight loss and the BMI and take into account a lot of confounding factors that now we know are important. Exercise, right? Alcohol. So when we talk about survivorship, we talk about things that are very interesting, such as, people are living longer with cancers, and with, surviving longer leads to other problems like obesity and diabetes and hypertension and other second cancers and recurrences of the cancer that you may have had. And so, being at risk for other cancers based on some genetic predisposition. So these are all the endocrine treatment complications that that go along with some of these very aggressive treatments, such as different types of chemotherapy that can influence the function of the heart. So I thought I would just spend a couple of minutes talking about second cancers and I gave you a handout from the National Cancer Institute, and it's very interesting. Lung cancer, as you would think, what you can modify is don't smoke, avoid radon, avoid asbestos, if you're redoing a house. Lung cancer, is also interesting because in smokers, there was a study that looked at supplementing these smokers with high doses of beta-carotene, which is like a precursor to vitamin A, and what they found was that they were at increased risk for developing lung cancer. So these are smokers who were on like high doses of beta-carotene, and they also found that they increased the risk of prostate cancer, and not only that, but they increased the risk of very aggressive prostate cancer. So it's not, getting a lot of supplements is not always a good thing. Take, for instance, in breast cancer, we really don't know whether or not soy is beneficial or not. We know that there was a theory that maybe in premenopausal women, soy would be more protective if you were a survivor, and then less protective if you were not. All of these things have never been proven. I think that the bottom line really is you got to look at people who are not affected, and you got to look and see how much they had in their diet before they were diagnosed. So these are really prospective studies that probably will never be done because there's no money in them to really do that. From the FDA would never approve something like that. I mean, these supplements are not even regulated. So we know that in reducing breast cancer, you should exercise a lot, avoid alcohol, you should try to avoid long-term hormone replacement therapy usage, and control your weight. Weight gain after menopause is like one of the most understood factor for contributing to the development of breast cancer. In colorectal, we think that a high fiber diet may be very beneficial, binding the biles and the fatty acids, decreasing the toxins that can be exposed, that you can be exposed to. So it also increases the transit time, not to mention other benefits for your heart. It lowers cholesterol, so it's a good thing. Is it definitely beneficial? No. But if you're eating fiber, you're not eating thick shakes and French fries. So that's also, Whole Foods need to concentrate on that. Colorectal, it's interesting because COX-2 inhibitors have also been shown to decrease the risk of colorectal cancer, but it's not something that your physician would tell you to go out and take Celebrex or aspirin to reduce that risk. And it also has been shown in postmenopausal women who are on hormone replacement therapy that it also may decrease the risk of colorectal cancer and adenomas, which may lead to colorectal cancer. Prostate cancer, people who had high supplementation of calcium also had a higher risk of developing prostate cancer. Lycopenes, such as what you would find in tomato sauce. Tomato sauce is a great source of lycopenes. That was found to decrease the risk of prostate cancer, as well as fish and fish oil. Esophageal and gastric cancer, well, there's two types of esophageal cancers. One is the upper part, squamous cancer, and then some antioxidants did show that there was a decrease in the risk of esophageal cancer. We know that in gastric cancer, H. pylori increases the risk of gastric cancer. That's why it's important to treat it. Endometrial cancer, what increases the risk? Well, unopposed estrogen, that increases the risk. Polycystic ovarian syndrome increases the risk. Obesity increases the risk of endometrial cancer. Cervical cancer, we know that HPV increases the risk of cervical cancer. So these are a lot of things that we didn't know before that we're learning, and you could go on the NCI site, but I think some of it is will be beneficial for you, but a lot of it is, hey, we don't really know this, we don't think it hurts, and we don't know how much it helps you. So the whole thing about the calcium, whether the calcium causes cell death, whether it decreases proliferation of cells, we don't really know. But we know that there are certain things that you have to provide in your diet. So with breast cancer, we know that there are certain things that definitely cause breast cancer, like ionizing radiation, whether or not you've inherited a BRCA mutation, right? I would say you can't pick your parents, so these are things that you can't change, whether or not you had acne and had radiation for that acne, or you had a large thymus and they radiated you. They did that in those days. Tuberculosis, that's, they did that. There was no problem in radiating you. They radiated people with their, they radiated feet when they wanted to tell what your shoe size was.
My in-laws just told me that.
So those are things that you can't change. What makes you vulnerable? And this is probably very similar to a lot of different cancers, but in breast cancer, what makes you vulnerable to develop cancer? Well, it's how early you got your periods, how late, or when you went through your menopause. So that's like that estrogen window. Did you have your kids under the age of 30? Did you use hormones for a long time? Did you have a biopsy that showed some precancerous findings, such as glomerulocarcinoma in situ? Those are all the things that also you can't change. So, and I'm sorry that I did not mean to say hormone replacement, because that's something you can do something about, and that's modifiable factors that contribute to the development of cancer that you can do something about. So you can exercise. 3 to 5 hours of moderate exercise a week is good for all different cancers. You can eat your veggies, which is pretty good. We don't know if it's going to be great, but we know that if you're eating the vegetables and whole foods, you're not bringing in 150 milligrams of isoflavones and having 50,000 units of vitamin D and all sorts of things. I mean, you're concentrating on whole foods. The other modifiable factors can be long-term breastfeeding, trying to avoid long-term hormone replacement therapy, limiting the amount of alcohol you take in. I usually like to say 3 drinks a week, and it doesn't matter grain alcohol or beer or wine. And weight control, don't yo-yo your diet, and watch, because there's creeping obesity later on in life, and it's really hard to get that pound off. I think this is a lot of common sense. Eat low in the food chain, eat grains and beans and fruits and fish and berries, and don't eat a lot of ice cream and unrefined sugars and hamburgers and red dyed hot dogs and French fries. And there's now something that came out this week about acrylamides that are found in fried foods such as French fries, and they have shown to increase the risk of breast cancer. So here are some tips, and you'll get these from the National Cancer Institute and the National Institute of Health, that you should consume adequate nutrients within your caloric needs, and I'll just show you that for a minute. But don't eat empty calories, because it's a waste, and it doesn't fill you up, and you're hungry afterwards. You should maintain your body weight in a healthy range. And it's amazing, if you plug in online your BMI, it's amazing how you can straddle what seems to be our definition of obesity. Engage in regular physical activity. There are some theories that physical activity increases your natural killer cells, which enhances your immunity. Consume a variety of fruits and veggies and whole grains and low-fat dairy products each day. And again, I would disregard some of the other studies that show that it's not a benefit. You should try to keep the trans fatty acids as low as possible, under 10%. Choose fiber-rich fruits and veggies and whole grains, which I know that Marcy is planning on talking about. Avoid high-sodium foods and eat more potassium-rich foods. And then try to avoid or limit the amount of alcohol you drink. If you drink alcohol and you take hormone replacement therapy, they act synergistically. So you get like a double whammy of increasing proliferation of your breast cells. And you don't want to, as far as preparing your foods, you don't want to boil the hell out of them, right? Steaming them. I'm sure you'll mention how you should prepare foods, because I like to hear that too. And of course, avoid tobacco. So if you go online, there's a million sites to show how many calories that you need, but a lot of this is based on your metabolic needs. So this is the Harris-Benedict equation. This is the stuff that we learned early on in surgical critical care, and we look at what our age is, if we're male or female, our weight, our height, and our exercise level, and we can calculate the calories, how many calories you should be taking in. And then if you want to lose weight, how many calories you need to decrease it. But if you're very active, you will need more calories. If you're not active, you can go all the way down there. So if you want to eat, you gotta work at it, right? Okay, so this is, and you have this in your packet. This is, supplements should not be taken lightly. They can be very powerful, and they can interfere with certain chemotherapy. Now, I like to advise people who are on chemotherapy to try to reduce the supplements that they take in, because it's not always known what that supplement can do. So I like a multivitamin, and that's really about it. But this is some of the drug interactions that you'll find, and you have that in your packet, and you can refer to it. And here's another table looking at the different kinds of herbal supplements and how that can also interfere with certain drugs. Some of them can increase bleeding time. I had a woman who came in this morning and she was all bruised up, and I said, "Why are you so bruised?" She's a young woman. And she said, "I don't know, I guess maybe I kind of walked into something." And then I looked and I saw she was on fish oil, she was on garlic, she was on aspirin, and she was young and had had breast cancer years ago, I said, why are you on all of this? You know, you also have to go to someone who's very knowledgeable about it. More is not always better. So now to introduce Marcy, I love what Julia's Child said. I was 32 when I started cooking. Up until then, I just ate. I feel like that's what I've done, although she promises to give me a lesson on plating and serving. So the joy of cooking, I think it's important to, you know, to find the time to really concentrate on what you're eating and how you're cooking it. And I also think that modifying your behavior when you go food shopping, and you go shopping when you're hungry, or you leave the containers in your refrigerator and they're all clear and not opaque. You know, it's easy to go in there and just basically, you know, unintentionally eat whatever's in sight when you're kind of hungry. Sometimes, you know, you have to kind of break things up. You have to change your seat at the table. You have to maybe not pass that that special gourmet shop when you're hungry that, you know, has a lot of truffles. Although I agree that, you know, chocolate's very good for you, especially if they have a high amount of cocoa, but not, you know, every day lots of truffles. So you have to learn how to modify your behavior a little bit, and your eating, and of course your cooking.